segue to talking about information. And earlier on at the beginning, Dr. Wong, you talked about decision support and accessing information. And it seems to me that that has to be one of the biggest challenges of practicing medicine now. There's just so much information. I mean, you can't possibly read the clinical journals, and that takes a certain scientific background to do as well. People have said that it takes X number of years for new clinical or scientific information to get put into practice. But obviously, electronic systems and computers and mobile apps and information systems can provide a lot of support, whether it's decision support, whether it's reminders, whether it's tools for clinical pathways. So wondering the degree to which this is incorporated into the education as well. I would think part of the limit has to be what the organizations you're working with have the capacity to do. But young students like yourself have really grown up with a technology in your hands. So I would imagine that would be something you'd be very interested in.
Yeah, I think what that has done is it has compelled those of us in education to rethink what we're doing. If you were trying to be plain about it, the model of the past century of medical education is the onus was on the schools and the teachers of the schools to deliver a lot of content, and deliver a lot of information to students so they would be able to cover all that stuff so the students would know they learned it. I think that's much less important now. I think it's much more important for us to be able to train students how to get the information, how to use it, how to weed out what is important and what isn't important, and to be able to do really critical thought about what is out there. Because anyone can get on the internet and find out information, but not everyone can figure out which of that information is really useful and what's not.
Mm-hmm. Yeah. So it sounds like you see quite a bit of variability, even in our region, in the practices, and even something as would seem to be as simple as exchanging information, lab results, or visit notes across practices.
Yeah. So all the primary, we've been in a few different health systems, and all of the health systems use a different EHR, so the electronic health records. And so oftentimes, if you have a different EHR, they might not be compatible with the specialist office that may be within a different health system. And so having to train on those, in the first place, so all of our students will train on these EHRs so that they can access patient records. But then trying to get that information to another office that might have a different record. And so you see some offices using fax still, some are using messaging. And so, it's a necessary evil. I mean, I'm not a huge fan of technology, but it's something that we have had, because we're in the clinic so often, we're exposed to day in and day out. And so it becomes kind of the norm for us to deal with things that may not go as smoothly as we would hope for the patient.
Is pager still being used? You still use that technology?
So it's kind of interesting. We're actually in the process right now of trying to identify whether or not we should give our students pagers. One of the things that goes along with that is because the technology is such that students are oftentimes communicated directly through cell phones, and physicians as well. There's messaging and all that stuff. We wonder if it's the wisest thing for our students to give patients their cell phone numbers. And so to have a pager as an intermediary seems like a protective device that might be necessary, but I don't know if that's been determined yet.
Yeah, or maybe a third-party app that can work with a cell phone but not reveal the cell phone number.
That would be another way to go. Exactly.
Yeah.